MiniLift uses the SystemRoMedic Thorax Sling to transfer patients from one seated position to another. The design of the Thorax Sling and the position of the sling connection points on the sling bar result in the sling actually hugging the torso of the patient, giving them greater security and comfort. In addition, the hugging feature prevents the sling from rising up under the armpits, making it particularly suited for those who are weak, frail, or partially paralyzed due to stroke. Before using the Thorax Sling, it is mandatory to read and review the instruction guide for use of the sling and complete the competency test. It is very important to select the proper size Thorax Sling for the patient's weight and body type. Prior to using the sling, visually inspect the sling for tears, excessive wear, and damage to the fabric, seams, loops, and straps. If fraying the sling loops and/or tears in the material are found, remove the sling from service immediately. Follow the facility, policy, and procedure for discarding slings. Slings may be wiped down using a quaternary compound and left to dry thoroughly. The slings can also be washed in 140 to 176 degree Fahrenheit water with a mild detergent and non-rinsing agent. The use of chlorine bleach will damage the material and reduce the life of the sling. The sling should be air dried if possible, as tumble drying will result in damage and increased wear. The Thorax Sling is only used for transferring a patient from one sitting position to another sitting position. The process is therefore identical regardless from where and to where we are transferring the patient. Before using the Thorax Sling, all operators should carefully study and understand the instruction guides for both the lift and accessories, and complete the MiniLift competency checklist. In addition, the patient's care plan should be reviewed for patient's activity level and any contraindications for using a lifting device for transfer. Some contraindications may be recent abdominal surgery, spinal deformities or surgery, recent lower prosthesis, or any inability to bear weight. Assure that the use of the lifting equipment and accessories are in full compliance with the patient care plan. Slide the Thorax Sling, waist belt down, behind the patient to waist level. The patient's arms should remain on the outside of the sling and waist belt. Fasten the plastic buckle on the waist belt and then comfortably adjust the belt to the girth of the patient's torso. The waist strap is only used to hold the sling in place while attaching the sling loops to the sling bar. The Thorax Sling has arm holders on each side for patients who have lost the use of either arm. Gently pull on the loops until the loops are taut. Then attach the same color corresponding sling straps to each connector of the sling bar. Push the sling bar back into the ergo arm as far as possible, removing any slack from the sling straps, and then let go of the knob, ensuring that it clicks into place. Verify that the sling bar is securely locked and can't move. To compensate for weak muscles in the lower body, we recommend that patients lean back with their upper body. This enhances comfort and prevents the Thorax Sling from sliding upward. Begin the lift transfer by pressing the buttons on the hand control. During the lift, the patient can participate by grasping the sling bar without pulling themselves forward. When raising, the upper body tends to narrow, causing the waist belt to slacken around the upper body. This is a natural tendency and does not affect the lift in any way. Never tighten the waist belt during this process. This will cause the belt to be overly tight when you reseat the patient. Once tension begins to raise the sling loops, make a safety stop and check that the loops are securely fastened in the sling bar hooks and the safety latch has moved into place to prevent the sling loops from accidentally coming out of the sling bar loops. After a brief safety stop, continue to lift the sling until the patient reaches the desired position. Now, transfer the patient to another sitting position. Lower the ergo arm to achieve a seated position. The waist belt should not create excessive pressure on the patient when in a seated position. In addition to the transfers that have been shown, the Thorax Sling can also be used for transfers to the car and other transfer applications. A Thorax Sling with seat support can be used to help patients stand that require added lift support. In conclusion, it is very important to select the proper sling for each lifting application. Taking the time to remember these simple procedures will pay off in years of safe and comfortable lifting for you and those you care for.